to be on your thing.
Hey, everybody. Welcome and thank you for joining us tonight. Dr. Darin Ingels here. And tonight I'm with Angie Walsh, who's a Lyme survivor and life coach out in Florida. And Angie and I, gosh, we did a conversation. Gosh, I feel like maybe it's been a year or so, right?
It was in April of this year, actually.
In April. See, the whole space-time continuum ceased to exist with me because I travel so much. I was literally at iLads last weekend, and I don't know how many times I kept thinking to myself, I have no idea what city I'm in. I kept thinking I was in Chicago. I was actually in Boston. So sort of the perils of what happens when you travel a lot. Sometimes you get confused of where you're at. So, tonight we're going to cover a few different things. And I thought maybe we'd start off just talking about some of the things that I learned at iLads this past weekend, because, everybody with Lyme is always wanting to know what, sort of the latest, trends are in Lyme disease and what sort of new frontiers are emerging. I think the one thing that came up in several of the talks is about disulfiram, or also known as Antabuse. There's been a lot of chatter in the Lyme community about this medication. And, the bottom line is that the jury is still out on this. Ken Ligner out of New York, he's really the one who brought this to light. And he had read a study from somebody else that suggested that maybe this medication would be beneficial. So he tried it on 3 of his patients, and I think 2 out of the 3 actually did pretty well on it. So since then, he's now reported that I think he's treated over 30 patients with it. And by and large, most people seem to be doing pretty well. And I know there's a study underway, I believe at Columbia, that will probably get published late next year with those results. So, we've got more data coming out on this medication. I've been a little bit reticent about jumping on the disulfiram bandwagon just because it is still fairly new. And for the people who aren't doing well, they're really not doing well. And for people who are interested in trying this medication, definitely talk to your practitioner. The things that you really need to be aware of if you want to try it is that it does carry a black box warning. And so when any drug has a black box warning, what it really means is that there's a significant risk associated with this medication that you really have to be mindful of. And the big thing with disulfiram is that, the way it works, this drug was designed for people who were addicted to alcohol, and so, or other types of drugs. So what happens is you take the medication, and if you get really, really sick. Like you'll get nauseous, you'll vomit. And so it's basically aversion therapy where it's just trying to prevent you from getting to that point. So if you're taking it for Lyme disease, you can't take any tinctures that have alcohol. You certainly can't drink any alcohol. And there's certain foods actually that will also break down in alcohol and can potentially affect you. So just be aware that you've got to be very careful about what you're putting in your mouth if you're on that medication. Again, for the people who've done well with it, I think they've done pretty well, but the people who've tanked on it have really tanked hard. And I think we hear this a lot about other Lyme treatments too, right, Angie? That,
it is.
Sometimes people do really well and other people don't. Have you had any of your clients telling you that they've been using this medication?
Yeah, actually I had 2 that they were taking it. They were having, one was having good results and one was having mixed results. And I had done the same thing that you had done. I cautioned them about it greatly because I had read a lot about it. And I'm like you, I'm kind of on the fence with it. If it works, great. But I think Lyme is so vast with everyone. It's not one thing fits all. And so everybody's rushing to, all in the Lyme groups, everybody's talking about this drug. They're wanting to know, who's taking it? How are you doing on it? How long have you been on it? And that's the thing. It's so new that there's not enough studies out yet. So it's just kind of like juggling right now.
Yeah. And I think, people need to be cautious too. And this happens a lot in the Lyme community with any treatment. What your experience is with the treatment may not necessarily be what someone else's experiences is. That's the plus or minus. So if someone had a bad reaction to a drug or an herb, that doesn't mean that you'll necessarily have that reaction. I think it certainly brings awareness, but I think we've seen across the board, whether it's an antibiotic, it's an herb, it's whatever people are using to treat their Lyme, sometimes it goes really well and sometimes it doesn't. So this is just, when you're doing any new therapy, you just have to be really cautious about being mindful of, again, how you're reacting, go slow. I know with some people starting disulfiram that they're, starting, again, lower doses that are even recommended just to make sure they tolerate it first before they increase the dose.
You do that with anything, but I mean, most people, they'll start, they'll go balls to the wall with it because they're like, they want results fast. You know, they want it
Right.
to
Yeah.
work.
More is not necessarily better.
Right. Exactly.
You
But
know,
that's how, like we were talking earlier, we were talking about how like everyone doesn't understand how everything plays in a part when you're treating Lyme or any kind of chronic illness. It's not just the medications. It's not just your diet, and it's what's suitable for your body.
right.
You post a lot on your Instagram account about, and on Facebook as well, but about the importance of self-care and
Right.
self-love and your diet for you. So you want to talk about the importance of that? Because like breaking it down so that people, because I feel like I constantly have to keep telling people this, and I don't have a problem with that, but like that's how you're going to get to wellness and maintain it, is by doing what got you to wellness. And then just like with anything, you got to kind of tweak it every so often because your body adapts, and then you got to change. So you want to elaborate on that?
Well, you know, I think it all starts with mindset, and I've had several conversations on some of the videos we've done. I've certainly posted online about it, and Dr. Tom Moorcroft and I have had a couple conversations about this too. And you realize that this is really setting the stage for everything else that you do. And I had a post on Instagram not too long ago talking about Lyme being curable, and I was sort of surprised at the people that snapped back at me and said, "No, it's not curable. It's not
I saw that.
And, look, I get it. I think to a certain degree, we're probably splitting hairs on semantics. Do we ever get rid of Lyme 100%? To be honest, we don't know. We don't have testing that's accurate enough to measure when it's completely gone. Do we get people to the point where they live symptom free? Yes, we do. And, to me, that's, cure. And the way I think of it's like, you can get chickenpox when you're 5 years old. You can get shingles when you're 55 years old. It's the same virus that's been in your body for 50 years. So a lot of these microbes, it's really about the terrain. And if you keep the terrain happy, you will keep these bugs at bay. Your immune system will live with it. It will live with you, and you don't bother each other. But I think before we start on some of these other therapies, we need to make sure our minds are right, and that we're envisioning ourselves getting healthy. We're sending positive messages to our body. I learned fairly recently. I've been doing some training with Michael Burnoff, who's an amazing facilitator of communication in Scottsdale. And, one of the things, he talked about, which I wasn't really aware of, is that our brain really responds to pictures more than words. Yeah. And so being able to paint that picture in your head, it really starts to set the stage of how your body's going to respond physically. So, we talk a lot about, visualization and, imagining what your life is like when you're well, incorporating all your senses into that vision. So what do you see? What do you smell? Who's with you? What are you doing? And sending that message on a regular basis. And I recommend daily, have a 5-minute set aside where you're going to start sort of meditating on that vision, because you're now sending that signal to your body that, this is where your body needs to change. This is what your cells need to do. And I know sometimes people say, well, it sounds like a bunch of woo-woo nonsense, but we've actually got a lot of research on how powerful the brain is in, inducing that kind of change. So I think, once we can start getting our mindset, right, then anything we start to do after it can, start to make a bigger difference. And I think it so much, ties in again to self-care, because when you've got your mindset right, you're now setting aside that time and, everything else you need to do to really take care of yourself.
You're right. And I think that, like, I figured that out after I was in treatment, but I've been, misdiagnosed for 16 years. But once it was like I've been in treatment for a couple of years, and I started thinking, I'm holding myself back from getting well. And that's when I started doing the self-care and saying, I am healed, I am well, and doing all the things that you're talking about now. Now, I would say it took me probably 2 years from that point of working on myself every day. And I had a lot of stuff to get rid of. That's what people don't understand. Like, all that stuff is like, you push it down and it's trapped. So you got to release it. Once you release it, then your body's more open to healing. It's more, because your body's designed to heal itself. So why do people think this is so woo-woo? I get it though, because I used to be that way as well. But when you're desperate, you'll try anything. And when it works, it works.
Yeah, I think people forget it is built into our DNA in every cell to heal.
It
We
is.
just need to get all those obstacles out of the way that stops that process from happening. I think sometimes we feel like it's got to be, cured with a drug, it's got to be cured
Yep.
with an herb. I mean, certainly that can be a facilitator, but ultimately, our DNA wants to do that. We just have to allow that to happen. So
That's
I
right.
think when we're on the subject of self-care, can you share a little bit about, what do you do for yourself for self-care?
Well, my happy place is the beach. So I will go to the beach and I'll
And you live in
ground.
Florida, so you're in the right place
I
for
know,
it, right?
right? I'm like 30 minutes from the beach, and I had made a resolution earlier this year that I was going to get to the beach once a month. And there was a few months that I didn't because I didn't do my self-care. So other self-care I do besides going to the beach. I've been going to the beach a lot more recently. And I feel better when I go there, like the air and the negative ions and all that. But
Yeah.
exercising, like if I miss out on exercising, I don't feel good. And I start getting kind of knocked down, getting tired. My sleep cycle gets off because I've got everything working pretty good. Like my internal clock, I get tired at the same time. Like you sent me a message last night and I was already asleep. I was like, I saw it this morning. I thought, whoops, I fell asleep kind of early. But I like, I walk. I want to get back to dancing and all of that. But I'm a year in wellness, so my body's still healing and I still have some tweaking and adjustments to do and all that. But, I'll get there. I'll get there. So it's just doing stuff that makes me happy. I tell my clients that you should do one thing every day just for yourself. I don't care
Absolutely.
if that's having a cup of coffee or tea or, watching the birds outside, something that's just for you, no one else. So
Yeah, I don't know if you see the show with Marie Kondo. She's the one that comes in your house and cleans everything up and helps you become minimalistic. And,
yeah,
one of the things that she talks about in her show is, if you're holding on to something that you may or may not really need, does it spark joy in your life? And
right.
I just love that phrase because I think it's something we can all relate to is that, what are the things that we used to do, or maybe we just stopped doing for whatever reason that really
Yes.
spark joy in our life. I think when you're not feeling well, it's so easy to get caught up in that we forget that we still have access to these things that really bring us joy and happiness. And, even if it's somewhat temporary, it at least takes us out of our current state and brings us into a different state, which all of that is just, positive stuff.
Well, I tell my clients and I've been telling friends too, like, you remember how you felt when you were like 18 to 21 or 18 to 25 in that area, where
Yeah.
you're laughing, you're having a good time. If you can get back to that mindset, but they're like, well, that's not being an adult. Well, you can still be an adult and have that mindset because when
Sure.
because I've told somebody that I had a friend in town and we were laughing so hard, like I almost wet myself because I was laughing so hard and they thought I was crazy for saying that. And I said, but you know what? It felt really good to laugh like that because
Yeah.
it'd been a long time since I'd laughed that way. And I think that that's a key factor too, is laughing, like that deep belly laugh and like where you can't breathe. That really helps. And you're breathing as well. I've talked about this as well. I'm sure you know about it too, with the people hold their breath and put their body in a fight or flight,
Right.
response. So doing shallow breathing does that. If you do deep breathing, do the meditation, but just watch your breathing, that's going to keep you calm and keep everything, good too.
Yeah, I mean, for me personally, laughter is one of my self-care things. I mean, I love to sit down and watch really stupid, horrible movies that are just so bad but they make me laugh. And I mean, there's
Right.
movies I've watched when I was a kid or when I was younger that
Yeah.
to this day I can still watch and just makes me absolutely roar. But again, we know from the research that when you laugh, you release all these endorphins, all these happy
Right.
chemicals. It increases your dopamine and all these things that are very good for your brain and your body. So
That's right.
yeah, getting around, whether it's with friends that make you laugh, whether it's watching a movie, whatever it is. I mean, that's again a very simple, easy thing that anybody can do on the cheap to start to
Exactly.
bring a little bit of joy to your life.
What about this? Because this was things that I find with my clients too. Is there when you talk about letting go of things that don't serve you anymore, or that a lot of people have a hard time letting go of relationships that don't serve them anymore, or
Yeah.
that are toxic. You're not going to laugh when you're in a toxic environment or you're with toxic people. So what are your feelings on that?
Well, yeah, I mean, I think, when you're ill, when you're having any kind of chronic problem, those toxic relationships all get amplified.
Yeah.
And I know what happens a lot in the Lyme community, and I'm sure a lot of people have had this experience. People, they don't believe you, they're not supporting you, they think it's in your head. I mean, we've heard it all. And, when you're trying to heal, that kind of negativity just doesn't serve you well at all. And I mean, I've told patients some cases, you need to get out of these toxic relationships. You need to get away from toxic people. Often it's family members, which is hard because it's your family. Right. But again, you've got to be a bit selfish, and you've got to preserve yourself, because at the end of the day, this is your life. This is your health. And as close as you are to other people, if they're not supporting you and loving you in the right way, that's not good for anybody. It's not good for them either. So it's very hard sometimes to take those steps, to be, have enough courage to walk away from something that's no longer serving you.
That's right.
I mean, I had to walk away, or I should say she walked away from me, but I mean, a 26-year relationship that no longer served its purpose.
Right.
It happens. And I think, surrounding yourself with people who are going to be supportive, care for you in the right way. You can't pick your family, but you can pick your team. And, we don't necessarily stay connected to people just because we have blood relation.
That's right.
We've got to pick people who we know are in our camp, who comprise our tribe. And it's your healthcare providers, it's your friends, it may be your family, it's whoever you choose. But, choose wisely. And don't be afraid to cut out those people that really aren't, serving you well.
And I think that's the thing, is there's fear. And people have this fear about letting go of things that don't serve them anymore, but they don't understand that once they let go of that weight, it's going to bring in all this other joy, from other areas, other sources, and in themselves. It's so important. And I guess before you can, self-care is important, but before you can fully grasp that, you got to do the self-love, and you have to work on loving yourself. And I know firsthand that I did not love myself, and that's when I started working on myself. And I was like you, I was in a marriage that didn't serve anymore. So I let that go. But then everything that came after that, I still had all that stuff to release from there. I don't know if you went through that as well, but it's a process. Healing is a big process. And people today, someone messaged me, tell me that it gets better. Tell me that where you are is better, that, you don't have anything. Well, that's not true. No, I don't have any symptoms. Do I still have good or bad days? Yes, I have more good than bad. And when I reflect, I'm better than I was last year, the year before, and, going backwards. But that people don't have to understand that the old you is dead. You have to let that go too.
Yeah, I mean, absolutely. I agree. And I think, like you just said, when you clear out the bad stuff, you make room for the good stuff. And I think that can be, related to, your relationships. And sometimes it's actually related to stuff. I mean, I've had people who literally go through and clean their closet, and all of a sudden it makes room for something that they really need in their life. So I think that's a good metaphor for just getting rid of anything in your life that no longer serves you in a positive way. And, it's just, it can be very hard. I think, fear, like you said, is a big part of it, particularly with relationships, fear of the unknown. I'm going to be by myself. I've got no one to care for me.
That's actually when you find yourself, is when you become alone, is when you truly find yourself. And when you can be happy alone is when you are truly happy, and you know that you don't need someone in your life romantically, but you would like someone. So
yeah. And I think, like you said, how we communicate with ourselves is a big part of that process. Yes. What I've learned working with Michael Burnoff for myself is I did not realize, I went with the intention of learning how to communicate better with others. And what I've come out of it now, having done a couple of trainings with him, is how I communicate with myself. Right. And I was really very unaware that I had not been communicating with myself in really a positive way. And I think, like most of us, we get caught up in our own, negative self-thought and things that kind of, chirps in the back of our subconscious. but it can really undermine us in a lot of different ways. Okay. So first of it, just having that awareness, and then beyond that, working towards changing that self-talk so that, you see yourself as a strong, positive, happy person that is looking to, make positive changes in their life, including their health. And, I think that awareness really starts influencing the decisions you make in your life, as simple as, what time do I go to bed? What do I put in my mouth? All these little choices we make every day that influence our health, you start making better decisions when you have that level of awareness.
That's right. Well, and when you're putting yourself first, and most people are overwhelmed when you start talking about self-love, self-care, their sleep schedule, their diet, detoxing, exercise, all that, it's too much. And I know that you came from that place, and I came from that place too, where you're overwhelmed with all that thing. But if you take each thing and you start with yourself first, and then you just kind of move outward, when you feel more comfortable, then how about working on your clock, resetting your internal clock, which when I did it, and now I can adjust it accordingly. But the first time I did it, took me about 6 to 8 weeks of consistency. I mean, and that's what a lot of people don't want to. They don't want to do the work, Darin. So they're not going to get there if they don't do it. So like, how can we help people understand that they can get to where we are, and you're still going to have good and bad days because age and just the remnants of having an illness. How can we help them understand?
Well, it's challenging. And I think, Lyme is the greatest teacher of patience for a lot of reasons. We all want to get better faster. And as a doctor, I want to help people get better faster. I realize that, the body has its own clock in which it heals. All I can do is work with that. I can't necessarily make it go faster. We do everything we can to facilitate that, but some people recover very quickly and some people it's very slow. And I just got the phone before we jumped on with one of my patients who, she's been in Lyme treatment now for a couple months, and the needle hasn't moved very much, and she's very discouraged. And again, I think this is a very common scenario. And so, part of my discussion with her is just, assurance that, look, whenever you start any kind of treatment, this is like a starting place. It's not the end. This is a fluid, dynamic process, and we're constantly fine tuning it to find out what works best for you. And the nature of Lyme, of course, is that everyone's Lyme is their Lyme. It's different.
That's right. That's
why it's very hard to compare one person to another. And I'll do one therapy for someone that works beautifully and they feel great within days to weeks. And other people, I do the same exact treatment and it does absolutely nothing. So this is a little bit, I guess, of the art of medicine. And again, all the other factors that play into everyone's individual health. So this is where we have to go back. And again, how well are you sleeping? How well are you eating? How well are you taking care of yourself? Are you actually taking everything we recommended you to take? And sometimes we find there's those one or two little things that may seem somewhat insignificant, but really are the differences between, feeling well and not feeling well. So it's just constantly having to take stock of, like, this is what I'm doing. This is where I'm at. This is how I'm feeling. And then, we just keep kind of tweaking it along the way. But, again, I think, people, particularly if you're in that space where you're frustrated, you're tired, look, we've all been there, we like to see healing be the slow, steady curve where every day is just better than the day before.
Right.
That almost never happens. I never see that with anybody where we're like, honest to God, in 21 years of practice, I think I can think of one person who had very significant Lyme disease. She had pretty much every symptom you read about. And we started her on treatment. She literally came back a month later. All her symptoms were 100% gone. She felt great. And it's now been probably a year and a half, and she's been completely symptom free. I'm great, and I'm excited when that happens, but I'm like, that's also pretty uncommon. And that's not the scenario.
Like a lottery ticket.
I know. It's like, gosh, if it was just all that easy, life would be so great. But it's not. And that's not what most people experience. So I just, have to remind people again that,
let me ask you this, like with her, because a month's time. Now, if you are diligent, and this is my point of this, if you are diligent and you are really, really doing exactly what you're telling them to do, and that means everything, that means being truthful with you as well if they've slacked off or not done something. But with her, did she really take it so seriously that it was just like she was in, preparing for a final exam or something? Is that the kind of diligence that she did? Because that's the kind of diligence I did. It took me longer, but I did notice a difference in a month's time when I switched to natural treatment.
Yeah, I mean, she did everything I asked her to do. She changed her diet. She took all of her supplements or herbs. I mean, she followed everything to a T. Now, I have other people who do that too, and they don't necessarily respond in quite the same way. But in her case, I mean, yeah, she was really very diligent about following the program. So, but
That's
again,
good.
it's nice to have those one-offs every now and then to see that this is possible. The body can heal that way. And again, I just think she serves as a good example of like, yeah, this is what is possible. Again, most of the people I work with, that is not the way it works. Typically, it's 4 months, 6 months, 8 months, 10 months, 12 months longer to get people to the point where they really feel much better. I saw that Brulissa, I apologize, I didn't ignore your question. We were just kind of on a stream here. So Brulissa's asking that she's been diagnosed with POTS. And here that there may be a correlation with Lyme. Absolutely. This is a very common complication with Lyme disease. Lyme can affect the nervous system and create what we call autonomic dysfunction. Your autonomic nervous system is the part that controls your fight or flight, or what helps calm you down. So we call it, sympathetic versus parasympathetic. And part of POTS is really your nervous system's inability to control your blood pressure, essentially. So, as you go to sit and stand up, your blood vessels don't constrict the way they're supposed to. All the blood rushes out of your head, and then you feel dizzy, lightheaded, and so forth. So there is a common denominator with Lyme. It's very common with Lyme and a lot of the co-infections. So in terms of the way of dealing with it, a big part of it, of course, is just dealing with Lyme itself. As you treat the infection, a lot of that autonomic dysfunction gets better. There are a lot of other things for POTS specifically that I found to be helpful. We have a lot of people using trisalts, adding salt to your food, but trisalts is a bicarbonate formula, and we use it for a lot of different things, but it does add a little extra blood volume. It keeps water more in your blood vessels, so that helps get your pressure up a little bit. There's other nutrients. We can use licorice. We can use other herbs that help, again, increase your blood pressure. There are medications that sometimes can be helpful. Again, I'm a naturopathic doctor. I try to avoid medication if possible, but sometimes people do pretty well on Florinef or Midodrine, at least as a stopgap to, get you functioning. I have a young girl in my practice now who's got POTS, and she's basically in a wheelchair just because she doesn't have the strength to walk more than about 5 feet. Hers is pretty significant, and she's on Midodrine, and it's actually helping her quite a bit. So sometimes, again, I wouldn't be afraid of using medication if you understand that that's not the end all and be all, that you're still using that to work towards other ways of dealing with it. But I found in some cases it can really be helpful in just getting you more functional during the day while you're waiting for some of these other things to be more effective. So
I had that. I had POTS, and I would black out. I blacked out. I fell out of the shower. I would just fall over. So, but I found that nothing would really help until we actually started getting to, the co-infections and the Lyme. Then when those started improving, that's when that improved as well. So that was me.
And again, like everyone else with every other symptom-related Lyme, POTS can vary. Some people are very debilitated. Other people, it's more of a nuisance. So depending on how it affects you, you can decide what level you need to intervene at. Again, if it's really kind of mild and you're functional, you might just, like I said, add more salt to the diet, try salts.
Like baking soda. Some people use the Alka-Seltzer Gold.
It's the same concept of the bicarbonate. Yeah, Alka-Seltzer Gold, baking soda. I find that Alka-Seltzer Gold and trisalts works a little bit better than baking soda, but the concept is really the same. And actually, the other thing that seems somewhat counterintuitive is that sometimes even exercise, most people with POTS, they can barely move, but when they do move, because it increases your sympathetic tone, it actually does help the symptoms long term. So even if you can do very gentle exercise, as hard as it might be, long term, that can be another thing that sometimes can help a little bit. So
even just I know my mom, because I was one that had a hard time doing anything. So, but the doctor was like, just walk to the mailbox and back. Yeah. And my mom would walk with me so I wouldn't fall. So you don't want to do that by yourself, but if you have someone with you. So, but light exercises, if you're in bed or, just moving, just anything to move around. So yeah, you're right. It's good.
Yeah, I mean, when I first had Lyme, I mean, I could literally barely get off the couch. It was just fatigue. I fortunately didn't really have POTS, but I just had the fatigue, and I would literally plop on the floor in front of a couch, and I would just stretch. That's about all I could manage, and that actually felt good because even with stretching, you're moving your lymph, you're moving your blood flow. It's not hardcore exercise, but it's gentle, and pretty much anybody, regardless of their fitness level, can do that. And then once I got a little bit more strength and stamina, then I would do laps around the house, laps around the block. And then, ultimately I ended up studying martial arts, and then, got a black belt in karate, but that took like 8 years after my Lyme diagnosis to get to that point. So it wasn't anything that happened fast, but again, start with things that you find that you can do that are gentle, that don't make you feel worse. And I guess the other thing I'll say about exercise, I had this conversation with the patient yesterday where they're like, every time I exercise, I feel worse. I'm like, well, then don't do that.
You're doing too much.
You're doing too much. I mean, it's either too much strenuous activity, the duration was too long, the intensity was too long. So, it's not that you can't exercise, but then find a way to modify it so that you can do it without being wiped out for the next 2 or 3 days, because that's counterproductive.
It's really hard because you think your mind tells you that you can do more than your body can actually do.
Right.
So I remember when I first started walking and exercising, once I got past being able to go to the mailbox, I got down and I was 99 pounds. So my parents were always afraid for me. They were right there with me. So my mom's like, all right, walk. And she's a retired RN. So she's like, walk to the next door neighbors. And I'm like, I can walk further than that. She said, no, just go there and come back. And so then when I would do that, for a little bit, then we'd add another house. And they live in a nice neighborhood. Then I was allowed to walk around the circle, and then it just increases. So then you feel empowered because you're not, if you do too much and you're put in bed, then you feel defeated, and it makes you more resistant to try again.
Exactly. Yeah. And I think, what happens is when people start to feel even that window of feeling a little bit better, now they really want to go out and take on. They haven't done anything for so long. And I get that, but you just have to be conscientious that you don't want to push yourself to a point where you wipe yourself out again. It's not helpful. It's not good for your physical body or your mental body. So just ease into it, go slow, take your time, find what works for you. Don't be afraid to try different things.
Exactly. Even if just going to the grocery store, that's what your exercise is for the day, that's you getting out and doing something. Because when you push and you do too much, it's not worth being in bed for 2 or 4 more weeks just for that one day that you got out, and did too much. So it's better to have several good days in a row and then rest and listen to your body. That's the other thing. Listen to your body.
Absolutely. Jasmine just chimed in here. Hey, Jasmine, thanks for joining us. Dealing with Lyme, Epstein-Barr, mold issues. Her lymphatic system hurts so much, glands swollen, feels like a lump in throat, chest hurts throughout the body. Is this normal? Well, none of this is normal. No. I mean, I'd say, yes, if you're dealing with Lyme, Epstein-Barr, and mold, yes, that is normal. But no, that is not normal in the grand scheme of being human. So what can you do to help? Well, you're dealing with a lot of different complicated issues. The Epstein-Barr thing may not be the bigger issue. A lot of people, when they have Lyme, they'll have Epstein-Barr titers that are elevated. And I find actually quite often they're not the bigger chunk of what's bothering people. Exactly. Lyme and mold have a tremendous amount of overlap in symptoms. Yes. So, it's starting, with the basics. I mean, make sure that, you're minding your diet. That's really the first step on anything that you do. I recommend an alkaline diet. I find, again, that most people tolerate it well, and it really sustains you nutritionally, and it gives you all the right things to get your body to repair. When you start moving your body into an alkaline pH, most of your cells operate best at that alkaline pH. So when you're eating foods that push you in that direction, you're basically reducing inflammation, you're facilitating cell repair. So that swollen glands is your immune system being overactivated. So anything we can do to take that pressure off your immune system is ultimately going to help. So I think diet, detox is a great place to start. So hopefully whatever practitioner you're working with has you on some sort of detox regimen. That's really a great place to kind of get the ball rolling, because as you start to detoxify your body, clean out the lymphatics, clean out the gut, now when you start moving into more active treatment for, treating the Lyme, treating, mycotoxins or mold, your body's better prepared to handle that. So that might be a great place to start. And in terms of detox, again, a lot of things you can do. Some people do really well with sauna therapy. Some people do well with colon hydrotherapy. Some people do well with lymphatic massage. Some people will take supplements. There's herbs and nutrients that facilitate detox. So lots of things. And again, I've got a section in my book, if you haven't read it, that specifically addresses that. And I go into a lot more detail if that's helpful for you.
And what's your book again, Darin?
The book is The Lyme Solution.
That's right. It's a great book too. If you're out there and you're trying to self-treat, or you've been through all of the doctors, you're not quite sure where to go or where to start, his book is really great. I've read it, and he lays it out in layman's terms so that you can understand what to do and where to go and how to facilitate your treatment if you're trying to do it yourself, or with your doctor that's not knowledgeable of it.
Yeah. And again, I wrote the book because, again, I was getting calls from so many people from around the country, around the world, actually, that they had, they lived in areas where Lyme was just not recognized. Nobody knew anything about it. They were looking, to try and find anybody to help them. So, the book is written in a way that you can basically self-treat. I would love for you to be in the hands of somebody who really understands Lyme. It makes the process much easier, but understanding that depending on where you live, that may or may not be easily accessible. So at least there's a lot of things that you can get started on your own, and then hopefully you can get connected with somebody who can give you better guidance on that.
Now, do you treat worldwide?
I do. Yeah. At this point, I've got a lot of people just because, again, they live in areas where there really is nobody helping them. And I think my furthest patient, and I've got a few patients in Australia. I've got some in Hong Kong. I've got a patient in Bulgaria. I've got a few in the UK. So we're seeing people all over. And again, often these are in areas where they're told there really isn't any Lyme disease. And we just know that's not true.
Right. Well, I know there's two people that I've spoken to in Africa. One's in Johannesburg, and I forget where the other one is. I believe it's in Northern. And they getting diagnosed there, and then actually finding someone to be able to treat them. Have you treated anyone in Africa?
You know what? I do not actually I have one patient in Morocco. So I guess that technically is Africa.
Yeah.
Yeah, it's funny. I remember it wasn't this last iLads. I think it was the one 2 years ago. They brought in a doctor from, I think he was from Nigeria, and he was talking about Lyme disease in I believe, Nigeria. And I was surprised. I'm like, wow, yeah. I guess just lack of knowledge of, that part of the world. I didn't really know there were that many ticks. And certainly didn't know that Lyme was there, but they actually had several reports of people with Lyme disease, even in that part of the world. So again, it kind of doesn't matter where you are anymore. Yeah. I don't know that anyone's really fully immune from having been exposed. And again, nowadays, because everyone travels, and certainly if you travel internationally, I mean, one of my patients from Australia, where the Australian government says there's no Lyme in the whole country. They've tested all the ticks. There's no Lyme. But, she and her husband are world travelers, and they've been to parts of the United States that's endemic in Lyme. So they could have very easily gotten exposed there. So, this is sort of the political thing that we're still, going against. And I know that the IDSA has new guidelines coming out. They've been working on it for the last several months, and there's been a public commentary. And I know they're looking even to change the recommendations from 10 to 21 days of antibiotics down to 10 days. So I think they're going to shortchange, even people with acute Lyme disease even more than they already are. So, again, this is the politics of medicine. And
that's right.
So
they used to recommend 4 to 6 weeks of treatment.
The IDSA has actually never recommended that. They've never recommended more.
Not the IDSA, but I thought
iLads. Yeah. Now iLads has recommended Lyme, and they still do. So their recommendations have really not changed at all. But the conventional infectious disease doctors still take a very conservative approach and feel like, based on the literature, that 10 to 21 days is enough to get rid of Lyme, which makes no sense to me, because when you look at the replication cycle of Lyme, Lyme replicates every 1 to 16 days. And to put it in perspective, most bacteria in your body replicate about every 10 minutes. Right. So, and consider that tuberculosis, which is an extremely slow growing organism, if you get TB, you go on 3 antibiotics for 9 months to a year. And every infectious disease doctor recognizes that because it's such a slow growing organism. Right. Well, if that's every 15 to 20 hours and Lyme is every 1 to 16 days, why are we so reticent about treating people longer term with Lyme when this is a more slow growing organism than tuberculosis?
Exactly.
So I've never understood the logic on that.
Well, with Lyme as well, like we all know that you never just have Lyme. Like there's always co-infections along with that. So let's say you do treat the Lyme and you don't treat the co-infections, so you're still going to be sick. And that's what people don't understand, is that when their symptoms come back, it's not necessarily the Lyme. It could be co-infections or viruses or something else that's been activated by the virus, or bacteria. So it's a whole big, it's an avalanche is actually what it is.
Yeah, it's just been so disappointing. And, the government started this tick-borne disease working group. We were hoping that some really good things. So at this last ILADS meeting, one of the representatives from that group was there. She felt like they're making some headway. Maybe. Actually, the CDC, I just saw posted today about Lyme carditis. So there are a certain percentage of people with Lyme that get heart problems. And even the CDC says, don't wait for the test to come back. If you suspect it, treat it right away. Right. So coming from the CDC, I mean, that's actually huge. Big. So, maybe we are starting to make a little bit of inroads, educating people a little bit better. So, we'll keep working towards it, and hopefully we'll get better consensus on, what is the right length of time, what is the appropriate treatment, so that all these people stop slipping through the cracks. Because, I mean, honestly, I'm getting tired that, everyone I see has gone on for years. I have another new patient I just saw last week, and I got her results back today. She has spent 2 years. She lives here in the Los Angeles area, seeing all the top specialists at the big hospitals here. Nothing. She's been tired, joint pain, a lot of very classic symptoms. And I ran her Lyme test today, and it's a CDC positive test. I mean, anybody could have run it. There's nothing special that I did. I just ran a regular Lyme test, and she's positive. I'm like, if somebody had just run this, a year and a half or 2 years ago, could have saved her a lot of grief. Right. But again, I find, and I know Florida is the same way, because I see people in Florida that the knowledge of Lyme is just really not there. So each of us kind of, I guess, has our obligation to educate our healthcare providers on prevalence of Lyme. And, California, even the CDC says, is the 5th fastest growing state for Lyme disease. And yet I hear from doctors through patients that are being told that there's no Lyme here. And I'm like, well, that's just stupid. I mean, it's just ignorant. And, if you took 5 seconds to read, you'd realize that that's not true. And same thing with Florida. We know that the ticks have migrated out of New England. They've made their way all the way down the East Coast and on the West Coast, same thing. And now they're pushing inward. So for those of us that are already dealing with it, it's, it is what it is. We have to kind of pick up where we are now. But for those of your friends and family and other people who you think might be affected, who are getting resistance from the healthcare providers, I just urge you to, if you think they might be infected, just get them in the hands of someone you trust, that can help them make that diagnosis so they get appropriate treatment.
You made a comment a minute ago that you said, and I remember when I interviewed Dr. Strite in April, he said the same thing, that everyone has Lyme. So do you want to elaborate on that a little bit for people that are watching?
Well, I don't know that I would agree with that. I don't think everybody has Lyme. I think Lyme is probably a more common organism that we understand. I think there are people who get exposed that don't get sick from it.
Is that because their immune system's just better equipped at taking care of it, or? Yeah,
I mean, I look at myself when I first got Lyme. I had classic Lyme disease. I found it, I'm sure, within days of exposure. And 4 days into doxycycline, I felt perfectly fine. I had no symptoms at all. I think, but having, been bitten right before I opened my own business, and I was working long days, 12-hour days, 6-7 days a week. After 8 months of keeping up that schedule, then I started to relapse and get symptoms. Had I had a more normal schedule, my immune system probably would have been happy, and that could have been the end of that. So I think there's a lot of other factors that contribute to, how our immune system functions that allows Lyme to become more proactive. So for the people who never really got acute Lyme disease, who may have gotten exposed years prior to the onset of symptoms, probably something changed along the way that altered the way their immune system was reacting to the bug. And that's why they started having symptoms. So, you know, again, this is where I kind of keep preaching. It's really about the terrain. You know, we really have to fix the gut, the immune system, all these other things. And that will enable our body to really keep Lyme at bay.
That and other illnesses, because once you have a chronic illness or you have a disease like Lyme, even like MS or cancer, all of those things, they kind of go hand in hand. And that it has to do with your immune system and your body on how well it actually is, and you're maintaining it.
Absolutely. I saw that Jasmine also says, have you heard of the Balanced Health Scan? I would like to do that to check for co-infections, viruses, but for an affordable price. I don't know Balanced Health Scan. I think it's probably something along the lines of like the Zyto or an electrodermal screening device.
Okay.
Those things, the only concern I have with those devices is just that if you ever had exposure to any of it, whether it's actually causing a problem for you or not, there's a likelihood you might pick it up on one of those kind of screening devices. So the risk of those is they may not really be telling you what's actually active and bothering you. It could be picking up on something in the past that might not be bothering you at all. So that'd be my only concern. And Maureen is asking, does Rocky Mountain spotted fever cross-react with Bartonella? I'm not sure if you're talking about the test or symptom-wise. Test-wise, not really. Symptom-wise, yes. I mean, Rocky Mountain spotted fever, Bartonella can both cause neuropathy in particular. They can cause fatigue. They can cause joint pain. So clinically, that's why when we're testing people, we test for all of it. There's so much overlap in symptoms. It's very hard to distinguish one from the other. And again, unless you got the classic, Bartonella tracks, look like stretch marks, or if you got, the Rocky Mountain spotted fever rash. Again, most people who get infected don't necessarily get those, although the tracks with Bartonella are definitely much more common than the rash with Rocky Mountain spotted fever. But I've had some patients that had very generic symptoms, fever, fatigue, joint pain, swollen glands, and we find out it's Rocky Mountain spotted fever. They don't seem to have Lyme. They don't have Bartonella. They don't have Babesia. So just because, you've got one of these tick-borne illnesses, it doesn't have to be Lyme plus. Sometimes it's just the plus. It's just co-infection. And again, we know that if you live in the center part of the U.S. or southwest U.S., that some of these ticks carry Ehrlichia, they carry Rocky Mountain spotted fever, they carry anaplasma, and they don't carry as much Lyme. So you can feel pretty crappy and get exposed to one of these other things. So that's why, again, when we do testing, we just test for the litany of all of it, because clinically it can be very hard. Exactly.
So what do you when you were talking about the diet, you were talking about alkaline diet and pH. People should test their pH in the first thing in the morning so that they can see if they're too acidic, or because you tend to be more acidic when you're sick with Lyme.
So most people are going to be acidic in the morning just because your urine concentrates overnight. So I think even if you're very diligent with the diet. So I actually don't have people test it first thing in the morning because it's almost always acidic. The best time is actually about 30 minutes after you eat your meal, then test your pH, because that'll tell you how you're breaking down your food. Your urine's not concentrated anymore. And I usually have people when they're first starting this, really after every meal, 30 minutes, go check it, see where you're at. And once people have done it for a week or two, now they kind of know where their body's at and they don't have to test it as frequently. But yeah, you can buy these pH strips at any pharmacy. Very quick, easy way to see where your body's at pH wise.
Now, alkaline diet, a lot of people don't understand that some foods may be alkaline when you eat them, but they turn acidic, and vice versa. So you want to give examples of that?
Well, an alkaline diet is really referring to how the food breaks down. It's not about the pH of the actual food. So like lemons and limes are actually very acidic, but they break down to be very alkaline, and vice versa. So, when you look at all the foods out there on an alkaline diet, most plants, tend to be very alkaline forming. So when you look at the diet that we've laid out, it's really eating a mostly plant-based diet. We find that a lot of animal proteins, meats, eggs, fish, are either kind of neutral to slightly acidic. So I recommend that people don't stop eating them, but just don't make that the bulk of your diet. Try and limit your intake to about 20-25% a week. We also find that a lot of fruit, a lot of fruit tends to be either neutral or slightly acidic. So there are a few fruits like, watermelon that's alkaline farming, coconut, and things like that. But most fruits kind of in that middle category. And then the foods that are very acid forming the body. So we know that dairy is very acid forming. We know that junk food, because of all the corn syrup and preservatives, make your body very acidic. Coffee makes your body very acidic. And, coffee, again, for me, that was the hard one because I'm a big coffee drinker. I mean, I lived in Seattle for 5 years, so became, a coffee addict. But I did find, when I was like in the throes of Lyme, if I had just a hint of coffee, I would get, my neuropathy would flare up. I would get really inflamed. And I tried starting and stopping this over and over, and it was pretty consistent that that's what was happening. So I cut coffee out, really for 2+ years, and until I got to a point where I felt well again. Now I do drink a little bit of coffee every now and then, and it doesn't seem to affect me the same way. But I think when people are getting started, while you're trying to get your pH balance, probably pulling coffee out, pull black tea out. Green tea, for whatever reason, seems to be fine. Green tea is healthier for you anyway because of all the polyphenols. They protect against heart disease and cancer. So it's a better alternative than coffee anyway. But really just drinking lots of good, clean water is very helpful.
Okay. So do we want to talk more about iLads, or do we want to go into the Dr. Walls retreat that you went to this summer? Because that's big for
Dr.
MS.
Walls retreat is so much more interesting.
Yes.
I mean, to be honest,
there's a lot of people I know that have MS, and they're very interested to hear what happened there. And you were a speaker there, and I'm interested to know too.
Yeah, I mean, to be honest, a lot of the information at iLads, I don't think most of our listeners here would find terribly helpful. There wasn't a tremendous amount of things where I walked away of being, wow, this is really new, revolutionary. I think the only other thing that I thought was really interesting is that there's a lab now that's doing a new kind of testing called phage testing. They're called Red Laboratories, and they're somewhere in Europe. And these phages are things that are associated with the Lyme when it's active. So it may be the better test we have now to see if Lyme is active. So instead of relying on antibody tests to tell you where you're at, which really aren't that helpful at all, this phage testing may be a better marker for us on whenever we're doing treatment. We can see if we're actually really affecting Lyme in a positive way, that it's reducing its activity. So that's relatively new. I've not run that lab yet, so watch future episodes, and hopefully I'll have more to report if we start using it, see how it makes a difference. But yeah, I had a chance to speak at Terry Wall's conference. If you guys don't know who Terry Walls is, she's a medical doctor at the University of Iowa who has MS. She was in a tilt recline wheelchair for 7 years. And after kind of doing her own research, looking into functional medicine, she really just started implementing diet changes, a new exercise regimen. She had been on a lot of medication that really hadn't worked. And, for those that have MS, they tell you there's nothing we can do to cure it. All we can do is slow it down. And I was amazed as I went to this conference and talked, of course, with Dr. Walls and a bunch of other patients there who were really reversing their symptoms with, diet and lifestyle. So Dr. Walls wrote a book that came out a few years ago called The Walls Protocol. And there's a new revision of that book coming out next year. So we'll be talking more about it on our social media when it comes available. I think next March is when it comes out. But I think, the take-home message, even though she's really gearing this towards people with MS, we can apply this to anybody with a chronic illness.
That's right.
And so, through really managing your diet. Now, I talk a lot about alkaline diet. Her diet is a little bit different. And the biggest difference in her diet, again, still basically a plant-based diet. And she has it laid out, though, where when you start the diet, you're eating 9 cups of vegetables a day. So she wants you having 3 cups of cruciferous vegetables, 3 cups of colored fruits and vegetables, and 3 cups of basically like green leafy vegetables. So you're getting 9 cups a day. If you've never eaten 9 cups of vegetables a day, it is a lot.
It is.
It is a lot. And the one thing, when I was at the conference, this is the way she was feeding us. And even I could barely get through all the food. It was just like such a large quantity of food. I'm like, oh my God, how do you, I feel like a freaking rabbit eating all this. But, it's like you realize how good you feel when you're really eating clean food consistently, and you get away from the junk food, and you get away from coffee, you get away from all this other stuff. I did find that there's a little bit of adaptation period when you're eating that much vegetables. Basically, you fart a lot. You're going to get a lot of gas as your gut microbes are now adapting to the new food. So aside from that, which only lasts for a week or two, it's a very clean, healthy diet. And so she has her diet broken out into different levels. So level 1's basically get gluten and dairy out, which I'm hoping everybody who's watching is not eating gluten and dairy anyway for other reasons.
And then bread. Everyone's like, but it's gluten-free. No, it's not.
Well, gluten-free, it doesn't necessarily mean healthy either. So even eating bread, if it's made from potato flour and other things, it's not nutrient dense. It's not doing anything positive for your microbiome. So it's just, in her diet, so level 1, again, is, gluten, dairy free, 9 cups of, fruits and vegetables. Then level 2, it moves up. And then she has you start cutting out legumes. She's concerned about the lectins. I actually respectfully disagree with her on this. Stephen Gundry did a lot of work on lectins, and he feels like that, getting lectins out of the diet is a good thing because they promote inflammation. My issue is that pretty much all the research done is not in humans. And if you look at most of the world where high lectin foods are the staples of their diet, they eat a lot of legumes, they eat a lot of nuts and seeds, yet autoimmune disease in these populations is almost non-existent. So I just have a hard time kind of buying into that. If we're going to start pulling out nutrient dense foods like beans that have, protein, complex carbohydrate, healthy fat, I just have a hard time kind of getting on board with that. But, Dr. Wall's protocol is based on what she did for herself. So she's really just replicating that. And she pulled legumes out of her diet. And then, ultimately she gets into start eating organ meats. So she wants you eating liver. She wants you eating heart. She wants you eating kidney, because these organ meats are very good for repairing the brain and repairing neurons. So again, for Lyme patients, this is just as important as it is for MS. And, it's just a process by which you go through. So she really wants to get up to level 3, where again, you're now doing intermittent fasting. So, she likes you to do at least a 12-hour fast, which basically means for most people is they skip breakfast. You're eating lunch and dinner. So you go from 9 cups down to 6 cups of your fruits and vegetables because you're just eating less food. You're eliminating all grains. You're eliminating all legumes, and you're eating organ meats. And, it's not a hard diet to follow. I've actually been oscillating now between level 2, level 3 myself. I do have grains occasionally just because I live in a part of the world where rice is everywhere and it's just around. But I basically eat a ton of, different greens every day for my lunch and often for my dinner. In fact, when I get done here, I'll go have my dinner and it'll be a big salad. So it's not terribly difficult. I feel totally satiated, and I can mix it up in the type of things I put in the salads, the greens. You can cook them. You can have them raw. You can add in different protein sources. I do have a hard time with the organ meats. I just, I don't dig on liver at all. I never liked liver and onions, and thank God my parents didn't like it either, so we never had it. But
I was chicken livers. Are those okay?
Chicken livers, all that stuff.
I like those, but none other liver.
I do eat a lot of Vietnamese cooking, and they do use a lot of organ meats in Vietnamese, basically soups. If it's buried in a bunch of other stuff, I can tolerate it, but again, I don't go out of my way. Now they do make, there's a company called Paleo Valley that makes organ meat capsules, and they're basically like organic organ meats. So for people who really don't want to eat organ meats like me, you can buy these capsules and you can take them. And it's a way of getting those nutrients without necessarily having to eat the food.
Don't you find that since you've changed how you eat, like where you've cut out all of the bad stuff and you're going more towards like the vegetables and the plant-based and all of that, don't you feel that you crave those things more? I do.
Yeah. I mean, I found, exactly. It's like, I actually I was one of these people that grew up, I'm from Indiana, so we're meat and potato people. So, I grew up where salad was a side dish. Salad was something you ate before your food. And to get to the thought where, these vegetables can actually be a meal is just kind of a mindset thing I had to get over. And once I realized, wow, you can make this a delicious meal. And I'm fortunate to have a fiance who's really very creative, and she makes these beautiful salads. If you guys follow me on Instagram, I've posted a lot of these. They're amazing, and they taste great. So again, I feel full. I feel satiated. Mentally, I know I'm putting these nutrient-dense foods, different colors. So it's really helped a lot. I mean, I think when I really first started doing this, and I really just started doing this in July, I mean, I think since then I've lost 14 pounds, and
Oh,
I could
wow.
have afforded to lose a little bit of weight anyway. So it's helping with my metabolism. Last time I had my blood checked, I mean, I've always had like slightly high cholesterol, slightly high sugar, and now
Mm-hmm.
everything's like completely normal and looks great.
Nice.
So metabolically, I know it's helping. So
What about juicing? Do you
well,
juice?
juicing, it's not really part of Dr. Wall's protocol per se. She does have some things in her cookbook where, I mean, they're not really juices. They're more like smoothies where it's a
Okay.
lot of green, ground up greens with a little bit of, fruit in it. Uh,
Okay.
so I think those kind of things are fine. I'm not a big fan of just like carrot juice and like all the really sugary juices by itself, especially if it doesn't have the fiber in it. So
Yeah.
it's one thing if you use a Vitamix and you just throw all your vegetables in and puree it versus using an actual juicer where you pull out all the pulp, all the fiber, because there is health benefits to those other parts of the plant. So if you're going to juice, I'd rather you just get a Vitamix, just blend everything up and drink that, because now you're getting the whole plant versus just squeezing out the juice.
I like the juice. I do. Like I find that I personally find that I do better with juicing. Now I'll still eat the vegetables and stuff, but when I do the juicing, I actually feel better and my gut and everything, like it works better that way. It just works. But I'm always like that one, if you had a pie chart, I'd be that one tiny sliver, in the
Yeah.
pie chart that works for me. So medical freak in nature.
Well, like at the end of the day, again, it's what works for you, what your body adapts to. Again, I just find a lot of people who's like, I juice, and I ask them, what are you juicing? Yeah, I do carrot juice and apple juice and grapefruit juice. I'm like, wow, that's all just basically pure sugar without
Right.
getting all the other nutrients. And again, you got to take into consideration everything else you put in your body. So,
Right.
um, you know, it's all about the whole. But I
I
think if
mainly
people are just,
do celery, carrot. I do carrot,
yeah.
but I mix it with beet. I do the beet and carrot so that this the sugariness of the carrots cut down because carrots do taste sweet to me. Like when you
Oh
eliminate
yeah,
sugar from your
they
diet,
have a high glycemic index, definitely. So yeah, when you're using a lot of the high glycemic fruits and vegetables, again, without the pulp in it, particularly if you're prone to hypoglycemia or diabetes, you do have to be careful because it can spike your blood sugar.
okay.
Let me get us a couple of questions. Samantha asks, is Rocky Mountain spotted fever is not chronic? Oh, no, it can be chronic. Yeah, any of these tick-borne illnesses have the propensity to be chronic. So
Yep.
whether it's anaplasma, mycoplasma, Rocky Mountain spotted fever, definitely they can persist for a long period of time.
Yep.
Can these infections be killed, making the body more alkaline with diet? It's a great question. I don't think so. I don't think it's a function that the alkalinity is what kills the organism. I think in making your body more alkaline, your immune system works better and it's more efficient at getting rid of the organism on its own. So it's an indirect relationship, but making your pH more alkaline by itself, I don't think is enough to kill the bug. Diane, hey, Diane, thanks for joining us. How about eggs? Again, I think eggs, in Terry Wall's protocol, she actually removes eggs. As part of my protocol, I think eggs are okay in small quantities, so
Me
probably
too.
no more than a couple, 3 times a week.
Yep.
And Jasmine chimes in again. I definitely have to work on my diet. No, you're in Texas. Oh, Jasmine, I'm sorry. I know how it is in Texas.
Southern. Oh.
I just met with a guy who's from the greater Dallas area, and he's overweight. And we were talking about his diet today, and he just said, "Look, I'm from Texas. We love our barbecue." And I'm like, "Look, I
Right.
get it, but your barbecue is not serving you well."
Right.
So I know it's tough in Texas, but same thing. Like my mom's from New Mexico. I grew up on, I'll say, New Mexican food, which mostly like Mexican food. 5-6 nights out of the week. And at the time, it tasted great, but I learned years later that I was reacting to a lot of the stuff that I was eating. I used to have terrible joint pain. I had 3 knee surgeries before I was 17 years old. And in retrospect, it was all the crap I was eating. And once I stopped eating that, my joints felt great. I never had pain again. So making these diet changes can have a huge impact on your disposition towards inflammation.
It
So
does.
you can do it, Jazz. You got this.
You can. And I mean, and once you get to a point where you're on a really good diet, you can kind of have like a cheat day, but you can't have like a cheat every day. Like, it can only be like here or there, and it has to be in moderation. Like what you're saying, like with the eggs but there's some things that it's just not worth it if you do cheat because for me, like if I cheat and have some bread or something I know that I'm not supposed to have,
Yeah.
I swell up and I'm bloated and it goes on for like a couple of weeks. It's just not worth it to me. So
Yeah, and I've kind of learned that I actually don't recommend cheat days anymore, just because a lot of people, when they cheat once, they cheat twice.
yep.
The cheaters like to cheat. The other thing is that, again, if you, depending on your sensitivity level, that one cheat day could set you back days.
Yep.
And it's just not worth it. So, I mean, if a little bit slips in every now and then unintentionally, it's one thing. But if you're intentionally going out like, I'm going to have pizza day, that may not be such a hot idea. So, just be mindful of what you're putting in your body. And again, I think depending on the level of sort of how you feel, if you feel really horrible, just don't do it to yourself. It's not worth it. That negative effect that can last for days, it's just not worth it, because it makes you more dysfunctional than you might already be. So, you got to think of food as medicine. And everything you put in your mouth is either working against you or working for you. So why put anything in your mouth that's going to work against you? Let's put stuff in your mouth that's going to work for you. Sunny is asking about thoughts on Alinea. Would you take antibiotics for Lyme? I don't really use a lot of Alinea for Lyme. I know a lot of doctors do. It kind of makes sense chemically on what it does. Again, I don't use a lot of antibiotics in my practice for Lyme for a lot of reasons. Mostly most people I'm seeing have had Lyme for a while. The evidence of antibiotics being helpful for persistent or chronic Lyme is pretty low. You have a greater likelihood of having more negative effects from it than positive. It can damage your microbiome. It can damage your mitochondria. And again, I think herbs work really well without having that negative impact on your microbiome or your mitochondria. So I have written, I can probably count on one hand the number of prescriptions I've written for Lyme in the last, 10, 15 years. So it's not that I never use them, but I don't think it's necessary for most people. And I'm pretty well versed on herbs, that between all the different herbs that are out there, we can usually find the right mix of people that they respond well to without having to go down that path. But for people who do use antibiotics, I mean, Alinea is one of the many antibiotics that do get used. Alinea has a very different mechanism of action. And if I had to use antibiotics, I would probably use Alinea, just because it doesn't have the same negative impact on your normal gut flora. So from that standpoint alone, the biggest problem with Alinea is just getting it covered by insurance. It's very expensive. Getting doxycycline or amoxicillin covered isn't really a big deal, but you want to get somebody on Alinea for a month or longer. Often the insurance company fights you, and for people to pay out of pocket, I think it's about $800 to $1,000 or more for a month's worth of Alinea. So it gets to be pretty expensive. Dory, hi Dory, how are you? Did you already talk about the ILAD conference? Yeah, we did. Or at least we talked about most of it. So go back and just take a look at the webinar. Once it'll replay, it'll stay on our webpage after this, and you can go back and look at the Cliff Notes version. Is that there wasn't a lot of information. We talked about disulfiram a little bit at the beginning. I talked about some new Lyme testing, and those were really the two big highlights I got. Everything else was either they brought in a lot of speakers that spoke about things that had nothing to do with Lyme disease. I heard a talk on bronchitis. I heard a talk on some researcher testing something with some other type of COPD. So I don't know why they were there, but there was a lot of talks that really had very little to do with Lyme disease. So
interesting.
But yeah, go back to the beginning, and we had a little bit of discussion on that.
So you were a speaker at Dr. Walsh's retreat. What did you speak on?
Yeah, so my talk at Dr. Walsh's retreat was really about how infections are a trigger of autoimmunity. And again, I think this is why so many Lyme patients end up with, these persistent symptoms. I think once you get past that point of Lyme disease being an infection, it translates into Lyme being a trigger for autoimmune disease. And it's that autoimmune process that triggers a lot of your symptoms. So the joint pain, the brain fog, all these is not necessarily the organism invading the tissue, and that's what's causing the problem. It's your immune reaction to the organism that's causing it. So imagine your body treating Lyme like an allergen instead of a pathogen. It engages a different part of the immune system, and again, that's what causes a lot of the problems. So, my talk at Dr. Walsh's conference was really just to bring awareness that, Lyme, Bartonella, Babesia, herpes virus, Epstein-Barr virus, we've got a lot of microbes, which if you look in the literature, we've got evidence that they are causes of autoimmune disease. So it's just that awareness that, again, if you've got, rheumatoid arthritis, lupus, Sjogren's syndrome, scleroderma, MS, any of these autoimmune problems, you should be working with your healthcare provider to test for all these different things. And again, if you don't know what it is, you can go on to PubMed, which is the online medical database, and just type in whatever condition you want. And then in capital letters, write "and molecular mimicry." So molecular mimicry is the immune mechanism by which the immune system starts triggering these autoimmune reactions. So you can go in and type in vitiligo and molecular mimicry, and you'll find all these articles come up on H. pylori. You can type in, multiple sclerosis and molecular mimicry, and you'll find, Lyme disease and Epstein-Barr virus and other things that have been associated with causing MS. So again, we've got the evidence out there. It's just getting, doctors to frickin' read and start understanding this can be a trigger. Because a lot of these things, you go to the rheumatologist and they say, well, you've got rheumatoid arthritis. And you go, great, why? And they go, I don't know. Well, is it possible that, one of these microbes could be a trigger? And they go, oh, no, there's no relationship. Well, if you read, there is. Yeah. And often when you start treating that, treat the autoimmune disease, treat the infection, all these autoimmune problems start getting better. And I've seen it with my MS patients. I've seen it with, polymyalgia rheumatica. I've seen it with some of my, lupus and rheumatoid arthritis patients. I think with rheumatoid arthritis, the hardest problem is that people can get to a point where they start getting destruction in their tissue. Once that happens, I have not been able to reverse it, but we can often stop it from getting worse. But if you catch someone who's very early, I've got one patient who's diagnosed with RA. We caught it early, I think. She's also got Lyme. We've been treating her and her joints are fine. She's got no deformities. Nothing's changed. So if we can get her whole life and that's where it stays, great, we'll be golden. So.
I should have my aunt talk to you because she has 3 different kinds of RA and she's in Arizona, and it'd be just like a little hop skip over there for her to come see you. So,
well, it's something, again, I think people should at least, look as a possibility because it's common.
Yeah.
We have a few more questions here. Let me catch up here. Jasmine,
can't see the questions.
Yeah, the questions show up on my side.
That's good. It gives me a break for once.
Well, Samantha, let me go back. Samantha asked, what are the most effective herbal treatments for Lyme, BART, Rocky Mountain Spotted Fever? So the 2 protocols I talk most about in my book, and that I've had a lot of clinical experience with, is using a modified version of Dr. Cowden's protocol. So, Dr. Cowden has a whole protocol where every month it changes herbs. That does work, but it's very involved and expensive. So I found just using a modified version, which is a combination of Cemento, Banderol, Cumanda, and Bartonella. Those 4 often will deal with all of those different, Lyme and co-infections pretty effectively. And that's a pretty easy, I'll say reasonably cost-effective way to do it. I used to use a lot of Dr. Zhang's protocol. So Dr. Zhang's in New York City, and his are Chinese herbal medicines. So the Chinese herbs, it's a combination of Artemisia, Hatunia. He's got a formula for circulation. He's got one that's anti-inflammatory, and he's got another one that helps boost the immune system. And I outline all that in the book if you're interested. But between those 2, that's where I start most of my patients. I saw that Diane had also asked about Byron White. I do like Byron White herbs. I use them. They're very, very potent. So even drop doses of Byron White can produce a Herx reaction. So people, if you're using Byron White or Beyond Balance, again, they're very concentrated herbs. So literally, start with 1-2 drops twice a day. That's all you need. Beyond that, often people get really, sometimes, they get Herx, they get kind of irritated. So you just got to start slow. And I like Beyond Balance a lot too, because their tinctures are in glycerin. They're not alcohol. So for people who might be alcohol sensitive, and I actually interviewed Susan McCamish at iLads, or Scott Forsgren, Better Health Guy. And, we were talking about with disulfiram because so many people were wanting to try it. And they're like, well, can I take my tinctures? I'm like, well, if they're alcohol, no. But they can actually use. I'm back.
No, I thought.
No, my camera just cut out. So, So, I think the modified Cowden, the Zhang, is where I start most people. Byron White and Beyond Balance, their herbal formulas are geared towards whatever you're treating. So again, there's the AL complex from Byron White for Lyme, the A-BART for Bartonella, the ABAB for Babesia, the ARMSF for Rocky Mountain Spotted Fever.
Success with the Byron White.
Yeah, I've had good success with it. I love his A-myco. I've used that a lot for mycoplasma infections, and that works really beautifully. So again, all these herbs can work. It's just a function of what works for each person. So it's a place to start. And what I tell everybody, if you start any herbal regimen, give it 2 months. And if at 2 months you don't feel any improvement, then it's time to ditch it and move on to something else. But I just don't want people on for months and months and months to get no improvement. You're like, well, this is stupid. So 2 months is your limit. If there's no change, at that point, you need to switch protocols.
And a reminder that when people are starting those herbal tinctures or any herbs, that they should start one, give it a few days to make sure they don't have a reaction, instead of starting all of them. And if they're having a reaction, they don't know which one they're reacting to. Exactly.
Yeah, it's always a good idea to start things one at a time. And depending on your sensitivity level, if you know you're hypersensitive to things, whether it's herbs, supplements, medication, it doesn't matter. Always start things one at a time so you can just be clear how it's affecting you. And that way you don't have to guess.
Right.
Jasmine had also asked, any good recommendations on keeping ticks away from pets? Is standard medication for them okay? When I had a dog, I did not personally use the tick collar. There's a lot of chemicals in it. I had a 5.5 pound dog, so I was concerned that it would make her toxic. So they do make a lot of essential oil sprays that you can spray on pets. It's very safe for them, safe for you. So if you're going to be out, walking your dog, I don't know if you can walk your cat, if you have one of those cats. But you can always use like a lot of these essential oil sprays, and they're usually combinations.
I make my own bug spray.
Yeah. I mean, if you know how to mix essential oils, you can make your own spray. There's a lot of them out there, like, TikTok Naturals. And I know the Hopewell Pharmacy has a really good one in New Jersey. So there's a bunch of companies. You can buy these organic essential oil formulas, and you just apply it when they're going to be outdoors. And that might be the most effective way. I mean, my little, 5.5 pound Maltese, he had really fine hair. So doing tick checks when I lived in Connecticut was pretty much impossible. So in that case, just spray them before they're going to be outside, and that will be probably the safest thing you can do. I think it's a good idea to bathe them fairly regularly. If you live in a Lyme endemic area, it'll be easier to try and spot the ticks when they're wet than when they're dry. And so, at least bathing them a little bit more frequently. I know some vets don't recommend that because it dries out their coat. Again, I'm not a veterinarian, but I do have patients that will bathe their animals a little more frequently just so they can do a more thorough tick check.
Yep.
Sarah asked, is it possible to fix her gut after 1.5 years of treating Lyme with antibiotics and a diagnosis of mold toxicity? Absolutely. Your gut's the one tissue that repairs more rapidly than anything else. So even though you've been through the ringer with the antibiotics, it's always possible. It may take a while, but it's something that can be done. So yeah, I mean, my kind of go-tos, I mean, if you've never had stool testing done, I think it's not a bad idea to get an evaluation of where your gut's at. But barring that, I mean, I usually start people with a combination of, probiotics, glutamine powder, digestive enzymes, fish oil. I think is a very basic thing. Those are things that most people can tolerate well. It does start to help with cell repair. The thing you have to be a little bit conscientious about too, Sarah, is that if you've been on antibiotics long term, have you developed any kind of new sensitivities since that time happened? Because if you did, at some point, you may have to go back and deal with the allergies. Because I've seen people that never had like food allergies until they got Lyme. They go on antibiotics, makes their leaky gut worse. Now they're reactive to a whole bunch of things. So even if you're successful at clearing up the leaky gut, you may still be left with some of those allergy issues, in which case you might have to work with someone to help you deal with the allergy part. So
that's true. I had that problem. So, and I can say that now, like as of right now, my gut is finally getting straightened out. But I really from the beginning of this year through now, with all the enzymes and using Espolardi and different like detox probiotic and another probiotic, just switching the strains around on the probiotics has been really beneficial as well. So.
Yeah, with probiotics, there's at least a couple studies that suggest if you mix it up, it's probably better for you. So I usually recommend get 2 or 3 good ones and then rotate each week. So instead of doing each day, because that gets to be kind of time consuming, 1 week I'm going to do this one, week 2 I'll do the second one, and if you do week 3 I'll do a third one, and then just write on your box 1, 2, 3, and just change the box each time so you know what order to go in, and that's a pretty easy way to do it. But I do like, if there's a way of getting a stool test just to make sure that everything looks the way, because then you're not guessing. You don't have to know what you need to put in. Because some people do need more digestive enzymes, or at least a different kind of enzyme. Some people need a different kind of probiotic. Some people at that point have yeast overgrowth. You might have to deal with the yeast. So it does save you a lot of guesswork. But again, if you don't have access to a provider who's doing that type of stool testing, you can at least start these other things to get the ball rolling.
I agree. Now, someone that I was talking to, someone today that they have MS and they're changing their diet. They're doing some drastic things too, because, they're maintaining their wellness. They have the relapsing, remitting MS, but their belly has bloated up. And I said, well, it's probably because you're changing your diet and you may have some yeast in there. And, they haven't done the gut microbiome stool test thing. Yeah. But this would be what happens when you're changing things. Your body's responding to that, correct?
Right. And I think most have had the experience, especially if you've ever traveled outside of the country, every time you eat new food, your gut gets you a little gassy, a little bloated, your gut bugs are changing now to the current diet. And so even if you're just changing your diet, expect you're going to have probably up to a couple of weeks of, gas, bloating. Your stooling might be a little bit different. That's actually pretty normal. And then your body should adapt to the new diet, and everything should be okay at that point.
Good. All right. I want you to talk more about, because there's a lot of people that I know besides that have Lyme, and I know we have a lot of Lyme people watching, but there's a lot of people that'll watch us in the replay or whatever as well, but they have MS and they're struggling to, maybe they've had it for years and they've, the treatments that they were using, they're not working anymore. And so I know a couple people have bought Dr. Walls's book because I'm like, I said, have you read that? I said, because supposedly, it's pretty similar to the Lyme Solution. So I just wonder if it gets to a point with MS with Western medicine where going her route is more beneficial at the beginning than doing the Western medicine. What do you think about all that?
Well, again, Western medicine for MS the neurologist will tell you that it's really just to help slow down the process. And depending on what type of medicine, there's a difference between people who go on Copaxone versus people who go on a biologic that actually suppresses the immune system. The medicines are really more for people that have active inflammatory lesions in their brain. For people who might have old lesions that aren't active, the medicines actually really don't do anything anyway. So I think, the way that people get better, there was a gentleman who spoke at Dr. Wall's conference who's a professional cellist. And he was diagnosed back in the early 80s when there was really very little information at all outside of, drugs, which weren't successful anyway. And he just started researching people who lived a long time. What did they do? And he found a group of people that ate a lot of sweet potatoes, and they all lived to be 100 years old. So to this day, his diet's like 75% sweet potatoes. I love sweet potatoes. He goes, it doesn't necessarily make sense. He goes, but this is what I did. And when he got diagnosed, he had an MRI of his brain and spinal cord. He had 30 lesions between his brain and spinal cord. Wow. And I think it was over a decade later, he had a follow-up MRI and he had no lesions at all. Ooh. So this concept that MS can't be restored, can't be repaired, it's not true. We have a lot of documented cases of people that had MRI positive lesions, and after whatever they did, they do an MRI and they have no lesions at all. So again, the brain does have the capacity to repair itself. It's slow. Repairing neurons is horribly slow. It is. I think it's the medication. Anything that, even with Lyme, with you have neuro Lyme, and it affects your neurological. So your nerves can take years to heal. So even though you're not having any symptoms, you may have some neuropathy and some other things still that you may think is a symptom, but it's actually repair stuff going on, and it's just lingering stuff left over. It's not really a true active symptom. And neural Lyme, shares a lot of similarities with MS. I think MS for a lot of people is a manifestation of neural Lyme. That's just where it goes over the long term. I think that's what happened to me. So the process is the same. Again, there's not a drug that's going to cure that. Right. Ultimately, the way it's going to get cured is through diet, lifestyle, sleep, all these other things we've been talking about. Right. So that's got to be a critical part of
it's a lifestyle change.
It's really going to be about, changing your life to make
Right.
that commitment to eating healthy, getting good sleep. Bob, thank you, Dory. Yeah, Bob, he committed to, exercising, diet changes, doing all these things when he had really little to no help on that. So, I think it's the same thing as that, it's that commitment to, this is my life, this is my health. And for people who are already at that point of MS, I mean, your options are change your life now and stay out of a wheelchair, or don't. And, the average MS patient declines 10% per year. So depending on where you are with your diagnosis, within, 10 years, there's obviously a lot of, rapid decline. So, I think, this is something that, when I got my diagnosis, like, okay, it's like I was already pretty savvy on this, but it was just that extra kick in the pants. It's like, look, I really can't cheat with my diet. I can't cheat on my sleep. I've got to be very careful about everything else I do. I mean, like next year, I've been traveling a lot this year. Next year, I'm going to be traveling very little for that very reason. It's just, it's hard on my body. It's hard on my brain. Changing time zones messes me up. So, it's time to get serious about your health, and you just got to do the things you got to do to get well. And it's kind of like, if someone told you that whatever you have to do is going to, you're going to win the lottery if you do all these things, you'd be pretty damn motivated to do it.
That's right.
This is your life. This is your health. You've got to be motivated to make these changes. And again, I think anybody can do it. So Dory says, yoga, meditation, absolutely. I mean, all
is that
this.
Dory Smith?
No.
Is it? Okay. I was like, it's
different Dory. Different Dory.
Oh, I can't see the comments or anything, so I'm like, hey, let's see.
Yeah. So Dory also asked about, what do you think of Cyrex labs for stool tests? I don't think Cyrex actually does any labs for stool tests. Cyrex is all blood tests. Yeah. So stool testing, I typically use doctor's data. I don't use really any of the other labs for other reasons. I think GI map has a lot of flaws. A lot of functional medicine doctors are all over it. Again, I was a microbiologist before I was a doctor. I used to do all these tests. I've seen a lot of inconsistencies with GI map, and Genova is okay, but again, they do some PCR testing. I think it's kind of questionable. So doctor's data, to me, I know their medical director. He was actually one of my undergraduate professors when I was a microbiologist. I know they run a good lab. So that's who we use in our clinic.
That's good to know, because a lot of people do, a lot of doctors do use the Genova one.
Yeah, Genova's been very popular. Again, I got nothing against Genova. Again, they bought the old Metametrics lab, which was horrible. And they still utilize that part of their overall profile. So that one part of the test, I put no faith in at all. The rest of their profile, I think, is perfectly fine. But I know that doctor's data, in terms of when you do DNA testing, there's a whole process by which you have to validate these things called primers. And that's the way that when you tag a part of the DNA, that it's E. coli or strep or whatever it is. So there's a whole process you have to go through to validate that primer. And a lot of these labs don't go through that process. And so the easy way to think of it is, like, if you're building a house, if you're off in the corner by 2 inches, by the time you get to the opposite side of the house, you're off by 2 feet. This is what happens with PCRs. You're off a little bit in the beginning because you're amplifying it. You're going to amplify a bigger problem. And so you think it might be one thing, and really it's something else. So that's why I'm very cautious about a lot of labs doing DNA technology. It has a great place if it's right, but if it's not right, then it's horribly wrong. So I think you have to be, you as the person who's just being told, do this lab, you're not going to know as much. But from my perspective, again, I like to work with labs that have gone through the diligent process to make sure that they validated their primers and that they're getting good results.
So what about all these people that are doing their testing through the Ancestry.com or the 123andMe or whatever? What do you think about those? I'm kind of questioning those.
Well,
personally.
I think the SNP testing, there's a few problems with it. One is that they've actually done a little bit of research that depending on who you use, they find different things. So that's a problem. And if you're not getting reproducibility between the different labs that are testing your DNA, well, how do you know who to believe then? Is this really a problem or not? The other thing I sort of get bent out of shape with a lot of doctors that are really on the SNP bandwagon is, remember, just because, the average person has like 10 million SNPs. having these little point mutations are normal, just function of being human,
Right.
and they're not all a problem. So I see a lot of doctors now that are using it. I mean, to be honest, this is a way to sell you more supplements, because they go, oh my gosh, you've got a problem with MTHFR. You need to be on methylated B vitamins.
Right.
Well, maybe you do, maybe you don't. And just because you have the mutation doesn't necessarily mean it doesn't work. So
Right.
like MTHFR is a great example, because you can measure homocysteine. You can see if it's actually not working. Doctor's Data has a test that you can run through the whole cycle, and you can see if it's not working. So in that
Right.
case, you can actually measure if it's turned on, turned off. But a lot of these other SNPs, we don't at least have easy ways to measure about whether it's turned on, turned off. So all it is it's a disposition. And again,
Right.
I think some doctors have interpreted it that it just doesn't work, and therefore you need X to bypass that. I mean, your genes are what they are. You can't change them. So
Right.
there may be a way that we can circumvent it to a certain degree, or make other systems work better to compensate. But I mean, understand, our genetic pathways are so complicated, and I'm sure everyone's seen these different genetic maps and they go, wow, I can see how it all ties in. But understand that's one small part of a much bigger thing that you can't possibly even see. So
Right.
take it with a grain of salt. I think it has its place. I think our technology is ahead of our understanding right now.
Yeah,
So we
I
will probably
agree.
get to that point where we can take that data and better utilize it for patients. But if you're working with someone and they're telling you based on your SNPs, you need to take all these supplements, that is really not using the information in the right way. And even
I
Ben
agree.
Lynch, who's really, I think, kind of a thought leader in this, and wrote a great book called Dirty Genes. He'll tell you, it's like, look, your genes are what they are, but it's really the environment that pulls the trigger, and you've got to mind your environment to help control that genetic expression. So we're not going to change the genes, but we can change how they get expressed based on all this environmental control. So that's my mantra too, is, control your environment. That makes a big difference.
That's right. I totally agree with you. So what else can we, because when you start talking about your genetics and generational things and all that kind of thing, all that gets in there, plays a part, because a lot of doctors are doing that now too. They're looking into generational things and going back. Do you really think that is a key in trying to find out what is wrong with someone or where to start with someone?
Well, I mean, I think, you're getting into even something as simple as family history. I mean, family history can be important to understand, again, where the familial disposition is, and whether it's, a genetic, a specific gene or not. It certainly helps you understand, what the family disposition is. And there are things that we see amongst family members that we can't necessarily pinpoint is related to a gene or genetic expression. So, I mean, it's always part of our interview process that we're going through. We're talking a lot about family history. What are those dispositions? And particularly if there's a family history of autoimmune disease. Again, that's a big red flag for, particularly Lyme folk, that, is that increase the risk. From a treatment standpoint, I don't know that it's changing a lot. We're still doing the same things. It's still about diet, environmental control, and all these other things. But it at least gives you an understanding about what that risk might be.
Exactly. So what about, I want to ask you about this too, because I know a lot of people are speculating about this. They're coming up with things about Agent Orange, and that's like a Lyme trigger, and that's like a trigger for other things as well. Like if any of our dads, because my dad, he knows he was exposed to it in Vietnam, and he always used to say, I think I made you sick. And I'm like, you didn't make me sick. I got bit by a tick, and I had my immune system had been compromised like a couple years before that. So I personally don't believe that, but he used to tell me that all the time. So what are your feelings on that?
Well, we know from the research that there's actually a 3-generation transmission of chemicals and heavy metals. So, I mean, certainly whatever he was exposed to could have affected certainly his sperm. And so when he helped make you, it is possible that some of that, in terms of how it affected the DNA, it could have affected some of that expression. When mom has exposure, there is more risk just because mom's carrying that chemical in her fat. And because fat mass increases when you're pregnant, more of those chemicals can actually be released. So it's a little bit more of a risk when mother has that exposure than father. But both parents can contribute to that. So if he was exposed to Agent Orange, probably didn't have a huge impact on you. Where we worry about men who get a chemical exposure, particularly with regards to sperm, is really making abnormal sperm. And so we find a lot of men, when they get exposure to chemicals, their motility goes down, their morphology goes down, their sperm count drops. So part of the problem is just even getting pregnant when you've got damaged sperm, or there's some sort of, problem that happens during the development of the baby, where often those end up in, miscarriage or, early terminations. Like, it's just not a viable pregnancy. So, nature kind of has a way, when genetics screw up, to try and change it before it gets that far.
Exactly.
So more than likely, if you had that exposure, that probably would have been the outcome. But, the fact that you're here today tells us that that probably wasn't the bigger problem.
Right. Well, tell us this, Darin, like you had Lyme and you were, when did you get MS after Lyme? Because you said you had 8 years. And then were you getting MS when you still had Lyme, or was that after the fact?
No,
how did you know?
Many years after. Yeah. I mean, I got Lyme in 2002.
Okay.
And probably by 2005, early 2006, I was pretty well symptom free. I mean, I really didn't start getting symptoms until 2015 or 2016.
Oh, wow. Okay.
So, 2015, I think, is when I first started noticing little things. And it was very minor. I noticed I would, when I yawned, my arm would shake a little bit. And as soon as I got done yawning, that was it. I didn't have a tremor or anything else. And then I noticed I started tripping a lot, particularly if I wore flip-flops. And I've always been a very coordinated athletic person, so it was just odd. I would trip for what I perceived as no reason. And then I started noticing I was getting heaviness in my legs. My stamina was going down. I was still doing martial arts, and I noticed when I would kick a pad, I had like no strength behind it, no power. And I used to, have a lot of power. So it was like these slow, insidious things. And then finally got to a point where I started getting neuropathy in my feet again. And that's when I went and had an MRI and, got the diagnosis. So.
Okay. All right. So do you think that because I know Lyme patients that are watching this are going to be like, oh, am I going to get MS after I have Lyme?
No, fortunately, most don't.
Or I know a lot of people that get cancer. They either have it prior to Lyme or after. What's the connection with that?
Well, I think, again, it's more about immune systems. So I think whether it's anyone who's got Lyme or any other co-infection, anyone who's got any kind of autoimmune problem, again, when your immune system's dysfunctional, I think you're at risk for, cancer and some of these other chronic health issues. I mean, in my practice, honestly, I can't say that cancer risk is any higher in my Lyme patients than my non-Lyme patients. Okay. It seems to be about the same.
I just wanted to put that out there.
Yeah, again, same thing with MS. Do all Lyme patients get MS? No. I mean, most of them, they have Lyme and co-infection, and that's kind of where it ends up.
It goes.
There are some people who do go on to develop other types of autoimmune issues. Again, that's not the bulk of the people that I see. So I think it's a risk factor, but it's certainly not a sentence that if you get Lyme, you're going to develop one of these things. I think it can happen, but I think if you do all the things we've talked about, start getting your immune system under control, that goes way down. Exactly.
So that's the key factor right there, is like what you've said, is keeping your train and keeping yourself on a schedule and it's a lifestyle change and it's a regimen. Just like you said, you are winning the lottery basically by keeping your health up and by doing all the things necessary to keep you in good health, maintaining it. So why not do it? It's just, I don't know. When I talk to people and they're at this brick wall where you're trying to get them to see that around the brick wall, that if they can just get around it and start taking one thing at a time instead of all of it at once, one thing at a time, and just, it's like a flower, it just keeps blooming and opening up, and then boom, you're there. But it's not an easy thing to do. It's diligence, hard work, bravery, all of the stuff, but you can get there. And you and I are both proof.
Yeah, well, exactly. Again, everyone's path is their path, and don't compare yourself to everybody else. But Just again, I think as we said earlier, remember that, your body has the capacity to heal. Your brain has the capacity to heal. Your brain's very neuroplastic, which means it's flexible. It can change, but rebuilding neurons takes time. Sometimes rebuilding tissue takes time, and we just have to give our body the patience to do that. So, for those of you that are still, in the battle and struggling, hang in there. Tomorrow's another day, and we collectively, are going to continue to work together to help each other get to, a better state of health, and just knowing that, this is a possibility.
Exactly. Well, is there anything else that you wanted to talk about that we haven't spoke about tonight? We spoke about a lot of really great topics and
I think we covered a lot, and I think given the time, I know it's getting late out on the East Coast there, and for me, my stomach is telling me it's time to go grab
dinner.
So,
well, it's always a pleasure to talk to you and to have you. And I like how we did this tonight. This was something different. And you taught me something. Last time I taught you about Facebook Live. Now you taught me about this. I love
always learn something new. So everybody who joined us tonight, thank you so much. We always appreciate your comments. We're here for you guys. We want to help encourage you. And I know that when you've had, Jasmine said, had a tough physically, mentally, emotional day, we've all been there. We know what it's like. But we're here for you guys. We love you. We thank you for joining us. We're going to continue to lift each other up and fight the good fight.
That's right. Thanks, everybody. Thanks for joining. Thanks, Darin.
All right. Good night.
Have a good night.